All right, so let's dive right into this whole bird flu thing.
Okay.
It's been all over the news lately, and I think it's safe to say it's been pretty overwhelming to sort through it all.
Yeah, definitely.
There's so much information out there, and it's
Yeah.
really hard to know what to believe.
Right.
So today we're gonna break it all down for you guys. We've got some really interesting research here, and to be honest, some of the stuff we found is kind of surprising.
Oh, yeah.
Yeah, we're talking about raw milk and cats with rabies-like symptoms. It's
Mm.
it's a lot to unpack, but thankfully we've got our expert here with us to help us navigate the science behind it all and really understand what it all means for us.
Yeah, happy to be here.
So to kind of start off, can you give us a clear picture of what bird flu actually is and
Yeah.
why it's causing so much concern these days?
Sure. So bird flu or avian influenza is basically a type of flu that mainly affects birds.
Okay.
It's different from the seasonal flu that we see every winter, and it's causing concern because it has the potential to jump to humans. And while the risk to most people is still considered low, the virus is constantly evolving.
So when we hear about those cases in the US, like the 65 or so cases, how are people actually getting infected?
Almost all of those cases have involved direct contact with infected birds,
Okay.
and usually it's in a very hands-on way.
Hmm.
We're talking about poultry workers who are culling flocks, coming into contact with bodily fluids, feathers, that kind of thing.
So it's not just like walking by a bird or something.
No, no, it's a much higher level of exposure.
Okay.
Like one virologist described it as, making a mess and aerosolizing virus particles from the bird.
Wow.
So you really need that level of exposure for transmission to actually occur.
Okay, so if I'm just, walking by some birds at the park, I don't really need to worry too much.
Exactly. Washing your hands after being around birds is always a good idea, but you don't need to avoid them altogether.
Okay, good to know. Now, one thing that really stood out to me was this emergence of bird flu in dairy cattle. This seems like a pretty new development. What's going on there?
It's fascinating, really. What's interesting is the role raw milk seems to be playing. It can actually harbor really high levels of the virus.
Wow.
And we're seeing farm workers getting infected through close contact during milking.
Mm.
Imagine like splashing milk, those tiny droplets in the air. That's how the virus can spread.
It definitely makes you think twice about that glass of milk, huh?
It certainly raises some questions about how we handle raw milk and the potential risks involved. And what's even more intriguing is that scientists are still trying to understand exactly how the virus is adapting to survive and spread in mammals like cattle.
Yeah, that's a little unsettling. And speaking of mammals, I know a lot of people are concerned about their pets. Can cats and dogs get bird flu?
Yes, pets can get infected, and it can be quite serious, even fatal in some cases.
Really?
The advice is to keep them away from wild birds and, surprisingly, mice.
Nice.
Yeah, it turns out mice can actually carry the virus, and cats being natural hunters, they can get infected that way.
Yeah. I never would have thought of that. So what should pet owners be watching for?
Well, cats can have respiratory symptoms, but we've also seen cases of neurological issues that actually mimic rabies.
Oh, wow.
So if your cat starts acting strangely, disoriented or unusually aggressive, contact your veterinarian right away. It could be a sign of bird flu.
That's scary. Is there anything else that's putting pets at risk?
What's even more surprising is that many cats are getting infected through contaminated raw milk or raw meat that's found in some pet foods.
Really?
Yeah, it's a reminder to be really cautious about what we're feeding our furry friends.
So we've talked about how the virus is spreading now, but could this situation change? Could the risk level increase?
Well, there are two key things that would be red flags.
Okay.
First, a significant jump in human cases with no clear link to infected animals.
Hmm.
That would suggest that the virus is finding new ways to spread.
Yeah.
And second, evidence of the virus spreading easily between humans, what we call community spread.
So that sounds eerily familiar, like what we went through with COVID.
Exactly.
So if bird flu starts behaving like a typical seasonal flu, that's when we really need to be concerned.
Precisely. That's when the risk level could change dramatically.
All right, so we've got a pretty good understanding of the current situation now, but what's being done to monitor and control this virus? Let's unpack that next.
Oh, absolutely. There are definitely some proactive steps being taken to try to keep this whole thing under control.
So what are the big strategies in place right now?
Well, one of the primary strategies is surveillance.
Okay.
Think of it as like a global network of scientists who are constantly monitoring wild bird populations as well as domestic poultry and livestock.
Hmm.
They're tracking the virus's movement and looking for any signs of unusual activity.
So it's kind of like an early warning system trying to catch outbreaks before they spread.
Exactly. The faster they can identify a potential problem, the faster they can take action to try and contain it. And that brings us to the next strategy, biosecurity.
What exactly does biosecurity involve?
It encompasses a pretty wide range of measures,
Hmm.
but the goal is to really minimize the spread of the virus.
Okay.
So we're talking about things like strict hygiene practices on farms, quarantine measures for any infected animals,
Mhm.
and in more extreme situations, even culling entire flocks or herds.
Calling entire flocks sounds pretty extreme. Is that really necessary?
It's a tough decision, but it's often the most effective way to prevent a larger outbreak.
Yeah.
These viruses can mutate really quickly, so containing them early is absolutely crucial. Of course, there's also the development of vaccines.
Right. Are there vaccines available for bird flu right now?
There are vaccines for poultry, which help to protect the birds from getting sick.
Okay.
And that, in turn, reduces the risk of transmission to other animals and humans.
Hmm.
As for human vaccines, there are some promising candidates in development, but they're not readily available just yet.
So it's kind of a three-pronged approach: surveillance, biosecurity, and vaccines. It sounds like a lot of resources are being poured into this.
Absolutely. And it's important to remember that this isn't just a national effort, it's a global one. Organizations like the World Health Organization and the Centers for Disease Control are working closely with countries all over the world to monitor the situation, share information, and coordinate responses.
That makes sense. I mean, viruses don't really respect borders, so a coordinated global effort is essential. Okay, so we've covered the science, the risks, the strategies for control. What does this all mean for the average person? What can we do on an individual level to protect ourselves and our communities?
Even though the current risk is low, there are some simple practical steps that we can all take to stay safe and informed.
Let's hear them. What actions can we take?
The first, and perhaps the most important, is practicing good hygiene.
Right.
Frequent hand washing with soap and water, especially after being around birds or other animals, is crucial.
Okay.
Avoid touching your face, and if you cough or sneeze, cover your mouth and nose.
It sounds simple, but those basic hygiene habits really do make a difference.
They absolutely do. And if you're a pet owner, keep your pets away from wild birds and rodents, and avoid feeding them raw meat or unpasteurized milk.
Right. We talked about those risks earlier.
Exactly. Anything else? Stay informed. Pay attention to the news follow updates from health officials, and if you're planning any travel, check for travel advisories related to bird flu.
Mm.
Knowledge is power.
So stay aware, take precautions, but don't panic.
Exactly. We have the tools and the knowledge to manage this situation effectively.
Okay.
And one of the most important things to remember is that we're all in this together. From scientists and healthcare workers to farmers and pet owners, each of us plays a role in addressing this challenge.
We all have a part to play. Amidst all this talk about risks and precautions, it's important to acknowledge the incredible work being done by researchers and healthcare professionals all around the world. I mean, they are truly on the front lines of this issue.
I completely agree. And it's also important to recognize the resilience of nature. We've faced similar challenges in the past, and we've always found ways to adapt and overcome.
That's a good point. We've learned a lot today, and it's clear that this is a complex and evolving situation. Earlier, we were talking about the emergence of bird flu in dairy cattle and how it made us wonder what other animals could be at risk. That got me thinking.
Thinking about what?
If the virus can spread to mammals like cattle, could we see it jumping to other mammals as well? What about wildlife? Could this have wider ecological implications?
Those are really important questions, and they're actually at the forefront of scientific inquiry right now. We know that bird flu has the potential to infect a wide range of animals, from pigs and horses to even marine mammals.
Wow, marine mammals. That's concerning. So this isn't just a poultry issue or a cattle issue. It has the potential to affect a much broader range of species.
Precisely. And as the virus continues to circulate, there's always the possibility that it could adapt to infect new hosts.
And what would that mean for the food chain for our interactions with wildlife? It's almost like a domino effect.
It's a complex web of interconnectedness, and the potential consequences are pretty significant. That's why continued research, surveillance, and preparedness are absolutely crucial.
It seems like we've uncovered a whole new layer of complexity here. The potential for bird flu to impact wildlife and ecosystems adds a whole new dimension to this story.
Yeah, it really makes you think about how connected everything is.
It does.
Like, we tend to see these viruses as kind of isolated incidents, but they can really have a ripple effect across entire ecosystems.
Right. It's a good reminder that the health of humans, animals, and the environment are all linked. What impacts one impacts all.
Exactly.
Yeah.
So while we're focused on the human health aspect, we also need to consider the bigger picture, the
Yeah.
potential consequences for the balance of nature.
Yeah, for sure.
Hmm.
Understanding those connections and taking like a holistic approach is really essential for prevention and management.
Well, I think we've done a pretty good job unpacking this bird flu situation. We've talked about the virus itself, how it's spreading the risks and what's being done to control it.
Yeah. We even talked about some surprising things like raw milk and cats with those rabies-like symptoms and the impact this could all have on wildlife.
Definitely. We've gone pretty deep into the research and hopefully given everyone a better understanding of how this is all evolving.
And hopefully a sense of empowerment, too. I think knowing the facts and understanding the risks can help us make better decisions for ourselves and our communities.
Absolutely. Knowledge is power, and by staying informed, we can all play a part in protecting ourselves and the world around us.
As we wrap things up, I want to leave you with one final thought. We've talked about the potential for bird flu to jump to other species, even wildlife. So here's something to think about. What if this virus does become more widespread in animals? How would that impact the food chain? Our interactions with wildlife? The balance of ecosystems? It's a lot to consider.
Yeah, those are all really good questions. The answers are complex, and there's a lot we don't know. But I think by having these conversations and continuing to learn about this topic, we can better understand the challenges we're facing and work towards a healthier future for everyone.
Absolutely. Well said. I think that's a great place to leave it. This deep dive into bird flu has been really informative, maybe a bit unsettling at times, but I think it's given us a lot to think about. Thanks for joining us on this journey. Until next time, stay curious, stay informed, and stay well.